Welcome back, everyone. Among the ashes and scattered rubble of what was lost lies another potential danger, one not exactly visible to the naked eye. Growing health concerns for some of the first responders who rushed into flames in desperate attempts to save lives and homes. And this is the new concern. Some are even drawing parallels to the medical aftermath of 9/11. In tonight's Prime Focus, our Matt Gutman investigates what's being done to protect the health of those who protect us.
This is what the PCH looks like at Will Rogers.
That's Los Angeles Fire Captain Eric Scott in the initial hours of the Palisades fire. The flames bellowing down the canyons, tearing through the streets below.
When did you know that this was going to be different than almost anything you've ever dealt with?
That night of January 7th, the wind was unlike anything I've ever seen before.
Scott started his career as a firefighter paramedic.
It's a very fast-moving fire.
Now he's the public face of the LA Fire Department.
How many days were you out there working on that fire?
For me, I was out there personally for 28 days. So that was by far the longest deployment I've had over the last 20 years.
This fire has crested this little hill we're on. The entire basin here is engulfed in flames.
More than 16,000 homes burned in the Eaton and Palisades fires and thousands of vehicles. The fires cooking off a toxic brew of contaminants.
Were you wearing a mask the first few days?
We do the best we can. We carry masks with us, hoods, bandanas, but in a wildfire, it's 20, 30 days sometimes.
But now, nearly 6 months after thousands of firefighters battled those infernos, initially focused on public health and safety, many are now finding it's their own health on the line.
So you just pulled an inhaler from your pocket.
Right.
You never told me about that. You were actually still using it.
Yes. Yeah, just to be able to open up your lungs when you have difficult days.
That's a bit of a gut punch.
Firefighters in general are dealing with that all over.
Scott says he himself began experiencing respiratory issues while the Palisades fire was still burning.
For me, it was just started with a persistent cough that was annoying and didn't go away.
A number of different studies are now monitoring firefighter exposures to toxic contaminants from the LA wildfires, using everything from donated tissue samples to silicone wristbands that some of the firefighters wore as they battled the fires, which are now being measured for contaminant absorption.
Here we can see the different...
One study already reporting preliminary results from blood of a small sample of firefighters who responded in LA.
We found high amounts of lead in the blood of firefighters as well as mercury. And that also is consistent with the fact that those two toxic metals were very high in the air about 2 days before we collected the blood.
Dr. Kari Nadeau at the Harvard Medical School is part of the LA Fire Health Study, a 10-year collaboration of a number of different institutions working to assess the health impacts of the wildfire emissions.
We're really excited to be able to help our science get to the public in real time to help understand both the short-term and long-term effects of wildfire smoke.
The researchers have already been able to trace lead and mercury in those initial findings all the way to the cells of the firefighters. And these are toxic metals that could have potential consequences down the line.
They affect the DNA so that the DNA is changed in its function. In this regard, the wildfire smoke miscues the immune system so that it gets activated in a chronic way, so that it causes a lot of inflammation that can lead to diseases like lung disease, heart disease, brain diseases, cancer.
At Cedars-Sinai, Dr. Susan Cheng is studying the health impacts among both civilians and firefighters, impacts she says are already occurring.
That's actually translated to health outcomes that we're starting to see. We start to see them in our emergency rooms, in our clinics, and we're seeing the after effects take place even beyond those areas.
While doctors can't say with certainty that any one toxin caused someone's cancer, studies estimate that people exposed to wildfire smoke face higher risks of cancer, respiratory disease, and immune system changes. As these wildfires become larger, more intense, and more destructive, more firefighters across the country are being called in.
Wildfire was predominantly a West Coast issue. We're now seeing wildfires from coast to coast.
Edward Kelly is the president of the International Association of Firefighters Union.
We don't have anything on the market right now that is adequate to protect us from these exposures when we're fighting these wildfires.
Occupational hazards are still a chief concern in this line of work.
The fact is, the actual exposures we endure during the course of a career take a greater toll than the risk when we put our lives on the line day in, day out, going out the door. Testimony to that is the fact that we've lost more firefighters in New York City from their exposures working at ground zero than we did on 9/11.
My name is Michael O'Connell, and I'm a retired lieutenant from the New York City Fire Department. I want to personally thank the committee members for allowing me to be here today to tell my story, which is really no different from the thousands of others who suffer from their heroic actions.
These are the bills that, we got passed.
Now, retired Lieutenant Michael O'Connell has become an advocate for continued funding for 9/11 responders.
We went days with nothing, and then I want to say maybe a few days in, they gave you your regular painter's dusk mask. I think maybe by the next week, I remember having like a mask that had like a respirator.
In the years after, he was diagnosed with an autoimmune disease called sarcoidosis, related to his 9/11 exposure.
I live with this on a daily basis, and so many people are still getting sick and dying.
People are describing this as a 9/11 type event for first responders. Is that something that concerns you?
Yeah, of course it's concerning. We know the significant cancer and deaths that transpired. So they're learning best practices, and we're trying to bring that information here to Los Angeles.
And experts are hopeful the work being done now will help firefighters in the future.
There are therapies that can help prevent worsening of inflammation. There are therapies that if you can detect it early, you can get in early and try to prevent the worsening of cancer, for example, or the worsening of dementia, or the worsening of asthma. And detecting it early matters.
There is no doubt it's a long road ahead for Los Angeles, uncertainty for those who lost so much, including some of the first responders who rushed in to try to save what and who they could. Captain Scott's respiratory issues are ongoing, and he continues to see a pulmonologist.
We really encourage our membership to go to annual full physical checkup.
To get a baseline?
Yes, and then you'll have an idea when things are spiking, and not just try to be macho and put it off, but we got to try to take care of ourselves for the long haul.
And what remains strong, perhaps stronger than ever, might be the oath of the firefighter.
This is something we signed up for, and we're there to protect life and property, and we take the precautions that we can, and we move forward.
I mean, does it feel like you're mortgaging your future in order to do your job now?
To some extent, yeah. I mean, I don't concentrate on that, and I think, I'm just a spokesperson for all firefighters, and we're kind of built the same way. We're there to mitigate the emergency, to help those that we are sworn to serve, and at times that will and does come at our own risk.
Part of what makes them so heroic. Our thanks to Matt Gutman for that.